if you take a biopsy of a primary tumor and you go 1 centimeter over or a few millimeters in any direction, the mutation analysis may be completely different. Now, we need to be careful about interpreting that or throwing up our hands and saying, oh, this is just too complex, we're never going to make headway, because we don't really understand which mutation. So you may have 50 mutations in a tumor, identify them. Now, not all 50 are driving that tumor. There may be 2 that are what we call the founder mutations, the one that are really important, sort of like the beehive. You got the queen bee, you got a lot of other bees that if you kill them off, nothing's going to happen. And so it's the same with mutations. You probably have a few queen mutations that are driving a tumor, and you got a lot of worker mutations that aren't really all that critical. And so now that we've got the technologies to identify mutations and deep sequence and find mutations that 5 years ago we didn't have the capability of even identifying, we need to be careful about how to interpret that, because we're generating lots of data and we don't know that all that data is necessarily meaningful. And so sometimes, as I mentioned, there's a whole science that's been generated around the bioinformatics of how do you interpret this massive amount of omic data, genomics, proteomics, which is essentially looking at the protein level, metabolomics, which is looking at the tumor cell metabolism. It's all just demonstrating just how complex things are. And we need to figure out a way to synthesize all that information and integrate it in a way that a physician can gather that and talk to an individual and say, here's what your tumor is telling us, and therefore this is what I think is going to be the best therapy for your particular tumor.